Good morning, everyone. Um, Today it's the first lecture for pediatrics, and my this one will be more like an introductory lecture, explaining the different things, how pediatrics work, what is the importance of this field, and why we are studying pediatrics, and what are the important things which we have to cover in pediatrics. Okay, so first of all, of course, we are going to talk about the definition. Okay, so what is pediatrics? Of course, it's a branch of medicine. Okay, and which deals with, you can say, the medical issues related to infants as well as children, and also um, adolescents. Okay, so I will explain in a bit like what is neonate and what is an infant, what is a child, how technically we divide them into different groups. Okay, of course, so that when we talk about either we are talking about infants, either we are talking about neonates, so all of them they should make some make some sense. Of course, the age differentiation is very hard to know, what is the right age when a patient can be seen by a adult doctor or a internist or a medical specialist. um, like uh, uh, One funny thing, the American Academy of Pediatrics, they say all the patients who are under 21 years of age should be under the care of pediatrician. Okay, but of course, this thing is not practiced. Usually you can say even a 18 years old patient, they don't go to the pediatrician, rather they go to the adult doctors. Okay, so mostly, by the way, you can say uh, around 18 years of age, most of the people, they don't go to pediatrician, rather they go to like the other doctors. Okay, so to tell you, for example, infant, what is an infant? Infant is a child, a newborn, from the 0 day, you can say, or the first day of his life, or 0 day, of course, because when he will complete the first 24 hours, then it will be day one. It will be completed up to 1 year of life. Okay, they are called as infants. Okay, don't confuse it with the airline tickets, because the airlines, they consider up to the age of 2 years, they consider them as infants. That is for air tickets only, but in medicine or in pediatrics, anyone who is up to 1 year of age, they are called as infant. Okay, and what is a neonate? Neonate. A neonate is anyone, from 0 day of life to 30 days, or you can say the first the first 1 month. Okay, so they are called as neonates. So anyhow, what is the importance of pediatrics? Simply, um, this can be understood by, we can understand it by this way, that uh, like when the babies are born, of course, there is a specialization or subspecialization in pediatrics, which is called as a neonatologist, in which they take care of a newborn baby. Okay, and for example, I had some work experience. Around 2 years I worked in pediatrics. So simply, one thing is what they have a small body size. Okay, all these babies they have small body size, and when they have small body size, of course, like um, everything, like I will give the example of drugs. When we prescribe them any drugs, so we cannot give them the adult dosage. Okay, cannot be prescribed the adult dosages. Okay. Well, like when you work in pediatrics, one of the thing which you face, which is a big problem you face in the start, is like to remember the dosages, how to calculate the dosage whenever we prescribe antibiotics or even acetaminophen to any pediatrics, any baby. We don't go for the age, rather we check their weight. Okay, how much is the weight, and after calculating the weight, we prescribe them that we calculate their dosage, like what dosage we must give them. Uh, Whatever we have to give them, we have to give them antibiotic, we have to give them any drug. Okay, we have to calculate the dosage because, and that is of course according to the weight, because all the babies are different, all the infants are different. Okay, they have not everyone have the same weight, so you can found a 1 year old baby who can be 10 kilograms, you can found a 1 year old baby who can be 13 kilograms or even 7 kilograms. So we calculate the weight and then we calculate the dosage. Okay, this is like important thing. And one very important thing, we cannot prescribe, we cannot give all the drugs to babies. Okay, for example, I can give you an example of ciprofloxacin, of course, or um, tetracycline. Like these are the antibiotics which we give to adults, but not to the babies. Why? Because they can cause some developmental problems in the babies. Okay, same like gynecology. We cannot prescribe all the drugs to pregnant patients, pregnant people, because the drugs can be tetragenic, like they can cause some birth defects to the babies or in the fetus. Okay, so that's one of the reasons we cannot prescribe all the drugs to the kids, because they can cause many issues with their development as they are growing and they are increasing. So this thing is important, and um, like of course they have a lot of difference in their body. They have like different absorption, distribution, metabolism. Okay, and they have different requirements even because they are like growing age. So uh, like we vaccinate them when they are born, and of course they cannot eat anything, especially in the first year of life. So mm, first of all they completely depend on milk, and later on they start taking other things. So nowadays, of course, pediatrics is a big field, and there are pediatric surgeons, there is pediatric oncologists, uh, there is pediatric, or there are neonatologists which take care of the newborn baby, and there is like almost all the people who work for adults. We have the same one for what you can say pediatrician as well, pediatric patients as well. For example, there is pediatric cardiac surgeon, there is pediatric gastroenterologist, things like this. Okay, so all the specialities which we see in the adult medicine, you will found in the pediatrics. Okay, the subspecialties or super specialities, you can say, you can found in the pediatric groups as well. So like what will be the layout? I already sent you the course outline. What will be the layout for this lectures will be what we will start with the like general introduction, which is today and tomorrow. Like in the next lecture, we will talk about what happens when the baby is born. Okay, and what we do right after they are born. And once we are going to cover that, uh, I'm going to talk about all the common, you can say, conditions of neonates. Okay. Now, what is a neonate? See, again, I'm talking about these things in the start so that you must not be confused when I'm talking about a neonate, when I'm talking about an infant. Okay, so you must know like what I'm talking about. That's why I'm explaining these things. Okay, so neonate, as you know, neonate, like as the name shows, it's a newborn baby. So a neonate is the one who is just born up to 7 days of life. Okay, it is called as neonate. Um, so there will be many terms which will come, and I will keep on explaining them on the way. Remember, whenever I use the word fetus, okay, fetus. What is fetus? Whenever I use the word fetus, fetus is simply when it's inside the uterus, okay, or simply the unborn, or like the offspring which is not born yet, okay, that is called as a fetus. So whenever I use the word fetus, it means like it's not born yet, it's still inside, okay. So that is called as, of course, fetus. And there will be many other terms, of course, we are going to explain it one by one, simply. Like as the words keep on coming, I'm going to explain them. So, after like the general introduction, we will go on common conditions of neonates, and pediatrics is much like internal medicine. Like you are going to study the same pneumonia, for example, which you have already covered in the infectious. So the same pneumonia will be in pediatrics, but only the organisms will be, there will be a little difference between the type of organism which causes the same infection. Meningitis, you can say, which you already covered in infectious, they will be same in pediatrics, just there is some difference in the sign and symptoms. Okay, so much of the conditions which you study for the in internal medicine, of course, the same kind of conditions can happen to babies. Okay, I'm using the word babies because pediatrics deal with infants, toddlers, preschool going children, school going children, adolescents, and so on and so forth, right? So that's why I'm using the word babies. Okay, like children is the more appropriate word because babies sounds like small. If you're dating someone who is 13 years of age, he's no more a baby. Okay, so children. So like this section makes a very important part of the lectures of pediatrics. Why? Because as soon as the babies are born, there are certain conditions which can arise and how to deal with them. Okay, so we are going to talk about common condition of neonates. Like this will be there will be around 6, 7, 8 lectures on this thing. Of course, like we have to cover each and everything, and then we will go on systems. Okay, but before going on systems, we will talk about special, you can say, or simply common complaints. You can say common complaints. Okay, like some few things which are not present in the adult medicine, but they are present in pediatrics. Is, for example, when the teeth will erupt. Okay, what if the baby is not gaining weight properly? What if the baby or the child is not gaining height properly? Okay, so the common complaints. Um, there are something called as breath holding spells, some psychiatrical issues. Okay, so things like this. Okay, we are going to cover. Then we will go move on to the topic of genetics. Okay, why genetics is important, guys? Because as soon as the babies are born, so when we examine the newborn, okay, during examination we can found some dysmorphic features. On the basis of that, we can um, make a diagnosis, not make a diagnosis, but it can point towards things like, maybe you heard about Down syndrome. Okay, there is Down syndrome, there is Atwood syndrome, there is Patau syndrome, there is Klinefelter, Turner, like a lot of syndromes are there. So of course, like this genetics makes a very important part of pediatrics. Okay, uh, And yes, before, like in the introduction, what we are going to talk about is, in introduction we will talk about, you can say, the development of babies, okay, how they develop, okay, how they grow, as well as we are going to talk about what is the primary care we provide to pediatrics patients, okay, babies and things like this. Anyhow, like once we will finish the genetics, then we will go system by system. Like we are going to study cardiology, for example. In cardiology, we will cover, you can say, all the uh, congenital heart conditions, okay, cyanotic and acyanotic. We will move on, endocrinology, okay. We will go for gastroenterology, okay. We will move on, for example, hematology, okay. And of course, like I'm not going to discuss each and everything in hematology or gastroenterology or cardiology. Rather, I will be focusing on more on the topics which are specifically related to pediatrics. Same like oncology, maybe like just one lecture, okay, and so on. Like we are going to cover um, nephrology, neurology, respirology, okay. Like I can just give you an example. Infectious disease, for example. Like in infectious disease, you already covered pneumonia, meningitis, okay, things like this, gastroenteritis. So of course, like all these conditions can occur in babies as well as in adults. But there are few conditions which are typically related with kids. We are going to talk about that. For example, mumps is there, chicken pox is there, measles is there, like most of the rashes, okay. So in infectious diseases part, we are going to talk more about, you can say, the childish problem, like the problem to the kids specifically, okay. So this is how we will move, okay. And to start with, of course, like as we are studying this pediatrics from clinical point of view, and whenever like we are studying anything from clinical point of view, so we always talk about taking history, how to do examination, what to do. Like I always talk these things in the start, guys. Um, History and examination, for example, I will name it like this, okay. So history and examination, or in pediatrics, you can say, okay. So the important thing is the events of, uh, you can say, the whole pregnancy, okay. Pregnancy are totally or completely connected with the newborn, or like what will be the health of newborn, okay. So of course, like I will talk about that. Like whenever we take history in pediatrics, and of course, like it doesn't make any sense if you're asking about certain conditions, or taking history for a 15 years old boy, for example. Of course, you will not ask about the questions from history, pregnancy. But of course, if you are seeing a baby who is just newly born, or if you are seeing a baby who is 1 year of age or 2 year of age, so there will be a lot of issues which you can get clues from how the pregnancy was, okay. So did the pregnancy went well, okay. This is very important part in pediatrics. Of course, when you will study gynecology, ob especially, so you will got a lot of things, and both you will found that there is a lot of correlation between that. For example, um, one thing, whenever the women's or the families, they are planning to conceive, okay, like they are doing a family planning, and they are planning that they want a baby. So nowadays the doctors, they ask them to take folic acid tablets every day, okay. Why? Because now, why taking acid tablets before pregnancy? Like the best way is to start taking the folic acid tablets before you are planning to get pregnant. Okay, why it is needed? Because there is something called as neural tube defects. Okay, like what is neural tube defects? Like like the spinal cord and the brain, they are formed from the neural tube. So the studies have found that all the females who are deficient in folic acid, they have increased chances of developing, like their babies having increased chances of developing neural tube defects. So that's why we always tell the mothers or the families that once they are trying to conceive, so start taking folic acid tablets. Okay, uh, the good thing is you don't have to remember the dosages, but uh, it should be taken every day until the end of first trimester. Okay. Now, what is first trimester? Simply, pregnancy is around 37 to 42 weeks. Okay, so pregnancy is divided into 13 weeks of trimesters. Okay, so from the time of conception, from the time of conception, I will write over here, from the time of conception till you can say the 13th week is called as first trimester. Okay, and from that time until 26th week is second trimester. Okay, and after that till delivery, or you can say till onset of labor, is called as third trimester. Okay, third trimester. Remember, like this first trimester until 13 week, why this is a crucial time, because this is the time when the organs are forming, or organogenesis is going on. Okay, so this is a very crucial time, by the way, this one, the first trimester, because this is the time when different organogenesis is going on inside the fetus. And if, for example, the female is taking some drugs which are teratogen, there are many drugs like lithium and many other drugs. So they can cause problem with the formation of organs. Okay, and the baby, when they will be born, what you can say, with many congenital defects. Okay, so that's the importance of this thing. We should take care, like the females, the obs guys, they take care of the female, and they don't prescribe them with any drugs which can cause problem in organogenesis. Okay, as well as there are certain infections, for example, measles, okay, rubella. Okay, there are many infections, you can say, which can cause problem in the newborn. Okay, so one thing, when you will study OBS, you would know that there is something called as torch infections. Okay, TORCH, torch infections. And what is this torch infection stands for? T is for toxoplasmosis, O is for other infections. Other means, it could be chicken pox, it could be chlamydia, it could be XYZ other. R is for rubella, which I'm talking about, and C is for cytomegalovirus, and H is for herpes simplex virus. Okay, so before conceiving in developed world where the health system is good, what they do, they screen the female for torch infections. Okay, they check, like, either they had any infections, either they are vaccinated for rubella. Okay, why? Okay, now see why I'm talking about rubella again and again, because if the female is not vaccinated against rubella, and during the pregnancy, especially in the first trimester, if they are exposed to anyone who have rubella, and the female, she will be having an infection from rubella, what will happen? It is going to cause a congenital rubella syndrome in the newborn. Okay, and that's the reason, by the way, if someone who is not previously vaccinated against rubella, and during the pregnancy, if they are exposed to rubella, the doctors, they offer termination of pregnancy, because there are higher chances when the babies are born, they will be abnormal, they will be having congenital rubella syndrome, which means like a lot of you can say congenital abnormalities like hearing abnormalities, brain is not developed properly, and so like things like this. So like whenever we see any female, um, you can say like who give birth to a newborn baby or during the pregnancy, we always ask about like either they took any drugs during the pregnancy, either they had any infections, especially torch infections. Okay, torch infections, like I'm saying torch because like it's a mnemonic. Okay, and they are called as torch infections because T is for toxoplasmosis, O is for other infections, rubella, cytomegalovirus, and herpes. There are certain infections, and not just these, any kind of infections. Okay, we always ask about either they took folic acid. Okay, and of course, like our OB specialist is always taking care of the female, and it's their routine. Okay, we always ask about like if there is any conditions running in the family. Okay, so this is one of the thing we ask the female. Okay, during the pregnancy. So I'm talking about the history, like you started taking history from any female if you're looking there and their newborn, for example. Okay, so and how it is connected with OBS. Okay, this thing we always ask about um, during the pregnancy if there was any um, like a bad event or anything, like they had any trauma, they had any blood pressure, for example. Okay, blood pressure, do they have diabetes? Okay, why, for example, the diabetic mothers, they give birth to big babies, their babies are bigger in size, and they had a very they give a very hard time during labor. Okay, when they are born, like the labor is difficult, and they can get a lot of injuries during delivery. Okay, so and there are many other complications of being a diabetic mother. They can give, what you can say, there are increased chances of stillbirth even. Like when the babies are born, they are born dead. This is one of the things. Age of the mother is very important. Why age is important? Uh, when someone gets pregnant above 35 years of age, the Down syndrome, having Down syndrome baby, the chances increase too much. Okay, especially if the mother is around 45 years of age. Okay, the chances of giving a birth, giving birth to a Down syndrome baby are very, very, very high, and that's the reason when any mother who is more than 35 years of age and they get pregnant, the doctors, they offer them screening for the Down syndrome. Okay, so this is one of the things. So I'm just giving an examples, how these things are connected. So we keep on checking their like either they're getting any blood pressure, either they're having during any diabetes, and if they took folic acid, they had any bad events during pregnancy, they got ill, they got exposed to some infections, they were using any drugs, if they were using any drugs, what were the drugs, just to see like lithium can give heart effects, for example. many drugs, they have side effects. Then we always ask about labor. Okay, how was the labor was. Okay, either it was a normal labor, either it was a prolonged labor. Okay, and after labor, if the baby needed any special care. Okay, like most of the babies when they are born, they don't need any special care, just a small amount of suctioning is done, and the pediatricians come and they examine the baby. But sometimes the babies, when they are born, they are not breathing properly, so the doctors, they have to resuscitate them and they need some special care. Some babies, they need some incubators for some time. So we ask all these things, okay, in history. But right now, I will like now I will move on. You can say some special points which we ask for history. So of course, like depending on uh, why you're taking history, depending on that thing, of course, we plan our questions. One mnemonic to remember that thing is called as HELP. Okay, written in many pediatric books as well. What does H stands for? It stands for history. Okay, E stands for um, examination. Okay, and L stands for logical interpretation or deduction. What you can take the information from this history and examination. Okay, so your logical deduction of that out of that. And P is for plan of management. Okay, so like this is one of the thing you can say uh, which you can talk about, or you can remember like how the thing goes. And anyhow, like whenever we see any patient, we go by this way, especially when they are coming in outpatient department. We take the history, we do examination, and then of course we make some differential diagnosis. We go for investigation, or like, or how we can manage that case. So many of the problems will like arise when you are dealing with the kids, by the way. um, for example, you cannot trust someone who is 2 years of age or 3 years of age. They make stories. Okay, even you cannot trust someone who is 5 years of age. So like all the preschool, you can say, group, you cannot trust them. Of course, you need a lot of help from their parents, okay, when you're talking about them. So I already told you what is an infant. Infant is someone who is 1 year of age. I already told you a neonate. What is a neonate? A neonate is anyone who is less than 4 weeks of age. Okay, less than 4 weeks of age is called as a neonate. And after that, infant is less than 1 year of age. Okay, from 1 to 2 years of age, we call them as toddlers. Okay, because they toddle, so we call them as toddlers or toddler. And after that, 2 to 5 years of age group is called as preschool kids. And after that, they are school going age. And once the signs of puberty started appearing, we call them as, you can say, teenagers. Okay, simply the teen age group. 13, 14, 15, 16, 17, 18, 19. They are called as what? Adolescents. Okay. This is how we divide them. Okay. So simply, depending on like which age group you are checking, you will decide logically. Either you have to talk to the baby or to the mother or to the caregiver. Simply, caregiver can be anyone. It can be mother, it can be father, it can be some other guardian. So of course, like we talk to them. We are like rest all the things are same. There is no difference. We ask about what is the presenting symptoms. Okay, presenting complaint. Then we will go for history of presenting complaint, and then we talk about, you can say, past medical history. We talk about the family history, drug history. Home condition is very important, especially in the developed world because of child abuse and all this stuff. But here I will tell you a mnemonic, very important mnemonic, which I follow, by the way. What is the mnemonic when you're taking history of especially infants or toddlers? Okay, never forget BINDS. In which B is for birth. Simply You can ask like, how was the birth? Either it was a C-section, cesarean section, either it was a normal vaginal delivery, how was the labor, either it was prolonged, and either the baby needed any resuscitation right after birth or not. Very, very, very important. Okay, you will get a lot of points out of that. When we will discuss more pediatrics, you would know why I'm stressing on these things. Okay, I is for immunizations. Immunization. Okay. Always ask about like either the baby is getting all the immunizations on time. Why? Because the babies who are immunized properly, of course, they have like less chances of getting some conditions. For example, we immunize the babies against polio. We immunize the babies against chicken pox nowadays, measles, mumps, rubella, pneumococcal, like a lot of vaccinations we give to the babies. So that's why like they are protected against different conditions. BIN. N is when nutrition. Okay, we always ask about how is the diet of the baby, and when you talk about nutrition, you talk about like the weight gain as well. Okay, this is very important. D is for development. Okay, so how we can check development? Of course, there will be a full lecture on this thing. Maybe like tomorrow lecture will be about that. Sorry. Developmental milestones simply, not all the babies are same, but most of the babies, you will find them like they can walk around 1 year of age, which doesn't mean like if the baby is not walking at 1 year of age that is abnormal. But of course, a baby who cannot walk at 2 years of age is for sure is lacking something. Like the babies around, you can say 6 weeks to around 12 weeks of their life, they give social smile to the mother, especially whenever they see the mother, they smile at the mother. But of course, if a baby is not giving a social smile and he's like 6 months of age, so of course like there is some problem with the development. Okay, when we will discuss like how we check the development of the baby, we will discuss more about that. Okay, so developmental milestones we check. And binds. Okay, S is for sleep. Okay, like which is very important to ask, like it comes relevant in many of the things. Okay, so whenever we take the history from the mother, we do ask presenting complaints, we do ask about history of presenting complaints, we do ask about past history, medications, family, social, but we always cover these points. Okay. So of course, like in past history, I already talk about like what you have to ask about the labor and all the stuff. Okay, that's very, very, very important. So whenever we talk about, there are few things, by the way, when you will see, especially babies. Okay, babies means like 1 to 5 years of age, you can say. Either they will be vomiting, either they will be having fever and like stars, and sometimes either they will present with some rash. Whenever we try to find out the cause, we start like this way: good baby questions and bad baby questions. Bad doesn't mean a bad baby, but like bad health. So is there any fever? Is there any vomiting? Is there any cough? Is there any sound coming from the chest? Okay, like wheezing. How the baby is drinking, or how about the feet of the baby? Okay, is there any vomiting? Is there any constipation? Is there any diarrhea? Okay, things like this. So, and past medical history, of course, you will ask the mother, how was the birth? Okay, like this B will cover that thing. Family history and social history will become relevant in many when you're suspecting like some abuse or neglect. If you found that the baby is lacking something, or you are suspecting that there is some smell of some neglect or abuse to the baby, then of course we ask about social history. We ask who take cares of the baby. Either it's a single mother, and either it's like the father is also there, either that the relationship between mother and father, or like both of the partners is good, and either there is any bullying at school, because many children who face bullying at school, their development is disturbed. Okay, they are mentally disturbed, things like this. Okay, and if any, like if there is any financial issues in taking care of the babies, of course, like in developed world, not in all the countries. Okay, in many of the countries they don't care of these things. So like this is what we do, and how we take the history, and then of course we go for examination. Okay, and in examination, the things will remain same, guys. Like there is no difference in examination, for like there is no big difference, and we do the same thing. Like first of all, we check the general appearance of the baby. Okay, and we see like either you can see any sort of a very sick looking child, or either the level of consciousness is, either the baby is alert, moving, sleeping, things like this. By general appearance you can check like either the baby is well clean and well taken care of, the hygiene is good. You can get a lot of idea just by checking the general appearance of the baby. And now it depends, like what is the condition of the baby. For example, if the baby is coming in emergency, okay, then of course, like you will be paying attention on the same story which we have already covered in other lectures. Like you will be checking for airway, breathing, circulation. Okay, of course, if they are coming in emergency, okay, you will check like either there is any sounds coming from the chest. You'll be checking either like the baby is in like this way. So of course, like if the baby is coming in OPDs, for example, so after general appearance, we go for vitals. Okay, and vital means what? You will check the respiratory rate, you will check the heart rate, you will check the temperature, and you will check the oxygen saturation. For example, blood pressure can be taken as well. So this thing, okay. As well as, yes, in babies, one thing is very important. We always take the weight and we always take the height, because what we have to do is to plot a chart. Okay, I can show you, by the way. Okay, I will show you later this thing, and some other lecture, of course, how we plot a chart and what is like the growth chart. Okay, so height and weight is checked, and especially in infants, we always check the head circumference. Okay, head circumference is checked. One thing which I want to mention here, if you don't know the normal things, of course, how you can catch the abnormalities. Like in adults, the normal heart rate is considered as 60 to 100, and anything below 60 is called as bradycardia, and anything above 100 is called as tachycardia. So babies, when they are born, they have like a different normal values. For example, if I will talk about the heart rate, okay, like the babies who are less than 1 year of age, okay, their heart rate is somewhere between 110 to 160 pulse or beats per minute. So in them, tachycardia is anything above 160, and bradycardia is anything up below 110. Okay, the respiratory rate is 30 to 40 per minute. Okay, and their blood pressure is somewhere between 70 to 90 diastolic versus systolic millimeter of mercury. Like the babies from, okay, then suddenly every year it moves more towards, you can say, towards the adult value. For example, at 1 year of age it is 100 to 150. Okay, like I'm teaching this pediatrics for so long now, I remember the values completely. Respiratory rate decreased to 25 to 35. Okay, and systolic blood pressure is 80 to around 95. Okay, So like this way. And when like any baby is more than 12 years of age, okay, they have the normal values like 60 to 100 will be the heart rate, and 15 to 20 will be like the respiratory rate, okay, and like the systolic blood pressure is like 110 to 120, okay, the systolic blood pressure. So like from 2 years of age until 12 years of age, every year, you know, this 100 started moving towards 60, and this 150 started moving to 100, okay. So always like when you will consult any pediatrics book, of course you can see what are the values, okay. So we check the general appearance, we check like how they look like generally. In general appearance, of course, like you can check for any um, dysmorphic features, okay. And then, you know, um, simply depending on which system you are checking, for example, if you're checking respiratory system, okay, then you will follow the same thing like inspection, okay, palpation, percussion, and auscultation, okay. Then of course auscultation, okay. Then you are going to follow the same routine. So of course, like I will not talk about each and everything, okay. We are not here to discuss about this general physical examination thing, but inspection, you will see either there is any cyanosis, and, you know, auscultation, you will take out the stat and you are going to check. So whatever you are checking cardiovascular, you are checking GIT, whatever things you are checking, of course, you are going to examine that particular system, okay. And then you will start making your differential diagnosis, okay. When we will discuss certain conditions, of course, we will talk about that, okay. Like, you know, in the class the lectures are now 40 minutes, 120 minutes, but in the class, you know, there is a lot of time, because you enter, you talk a little here and there, and then you start. But here, of course, you know, 1 hour lecture is like too much of you can say studying. Anyhow, just I think like just 13-14 minutes more, I will make a lecture for 1 hour, okay. So like that's like how we examine the baby, and then we will make some logical differential diagnosis. Then we will decide either we want to go for any, you can say, investigations, or what will be the management, okay. We are going to do that. So anyhow, all the babies, you know, whenever they are born, they have some visits to the hospital, to the doctor, just to check like how they're doing, either they're developing normally or not. So newborns, okay, when they are released from the hospital, we call them 1 week after discharge, okay, to come and like on every visit, okay. Why these visits are there, again, it will sound more logical, or it will make more sense when you would know. Like there is something we do on every visit. We don't call them without any reason. Then of course, like there is the first month visit, then there is a visit on second month, then there is a visit on fourth month, okay. Okay, not every country they follow this thing, okay. There is a little difference, of course, in each country. A 6th month visit, then 9-month visit, then at 1 year of age, then 15 months visit, then 18 months visit, and then 2 years when they turn. So these are all in months, okay. And of course, like, you know, on each visit, we do take history, we check how they are doing, we do check their developmental milestones, we do examine them. Vaccinations can be given on these, and we do plot a growth chart, okay. That's a very important thing we do. Okay, so this is like the visits, and on every visit, what are the things we do? History, physical examination, we check the development, we check the nutrition, we give them immunization. The doctors, or the doctors or the nurses or the midwives, they had a good time to discuss with the mother about what to do, and what things to do with the baby. Simply, okay. So nowadays, routine immunizations are done. Okay, every country have their own. Okay, guys, I never recommend that you guys to memorize the immunizations. Okay, because every country have their own immunization schedule. For example, in China, they do give the babies vaccines from the rest of the vaccines, which we give almost to every baby. But they do give the babies, for example, Japanese encephalitis, hand, foot, mouth disease, and these kind of vaccinations, which are not given in other parts of the world. For example, in UK, in USA, in Canada, in Australia. Every country have their own, you can say, plans for vaccination, which are more or less the same. But for example, Japanese encephalitis is not present in the rest of the world, but it is too present in China, in Japan, and that's why they give them this vaccination. So I never recommend to memorize these tables, but I do recommend, when you will start working, you must comply with the schedule of immunization followed in that particular hospital or country. But I will tell you, generally, what kind of vaccinations are provided to the babies. Okay, almost in most of the developed world, because in the books what you will find is what is given to the developed world. So what we give is we give them DTaP. Okay, what is DTaP? DTaP, P is capital in this one. DTaP is basically used for this. D is for diphtheria, T is for tetanus, and P is for pertussis. Okay, so this is a diphtheria, tetanus, and pertussis, you can say, vaccination. Okay, and nowadays, the good thing, they make a combination of vaccines. One injection will be having 6 type of vaccinations, stuff like this. We do vaccinate them. We give them IPV. What is IPV? It is inactivated polio vaccination, which is given by IM injection. On the other hand, there is OPV as well, which is oral polio vaccination. For example, not given in most of the countries, but in poor countries who still don't have good medical system. So in those countries, they because they are cheap, so they give them the oral drops of polio vaccination. We do vaccinate them with all the newborns against hepatitis B. Okay, all the kids. We do give HIB, which is Haemophilus influenza type B. Okay, and that's the reason because of this Haemophilus influenza vaccinations, many of the patients nowadays, they don't get epiglottitis. Okay, one vaccination we give them is called as MMR. M is for measles, the other M is for mumps, and R is for rubella. Okay, so this is given almost all these vaccinations are given nowadays almost you can say every part of the world. Okay, then there are some vaccinations, so we can vaccinate them against rotavirus. Okay, rotavirus is a virus which causes dysentery, or you can say diarrhea, and it kills a lot of babies. Okay, we do give them vaccine. Okay, so very important vaccination I forget is varicella. Okay, varicella. Okay, chicken pox, simply, guys, chicken pox vaccination. Okay, is given. So MMR is given. This one is given. Okay, then in many of the countries, they are expensive, by the way. They vaccinate them against pneumococcus. Okay, pneumococcal vaccinations are given. Pneumococcal vaccinations are given, which protect them against different pneumococcal infections, as well as meningococcal vaccinations are also given in many of the countries, which protect them against meningitis and pneumococcal infections or meningococcal infections. Okay, so like most of the and like there is a combination of vaccination which have like six: one, diphtheria; T, tetanus; P, pertussis; IPV4, um, polio, and HIV. Okay, so like there is, and varicella. So there's a combination of all this thing, and what the doctors do: one injection they give like at the 2 months of age, then 4 months of age, then 6 months of age. So three injections, like all these things are covered. Okay, right after at the birth, they give hepatitis B vaccination. Then they ask you to come at 1 month of age, and then they ask you to come like 4 months of age, something like this. Like every country have its own, what you can say, schedule. Okay, so they keep on giving you these vaccinations to the babies. Okay, uh, many people, they don't get their babies vaccinated, especially in America. For example, there is a group who always fight that we are not going to vaccinate our babies. And in many poor countries also, there is a lot of myths about vaccinations. For example, vaccination, they cause serious problems with the health of the babies, and there are still many people in the world who don't get their babies vaccinated because they believe like it's giving them more harm than good. Okay, but nowadays, guys, the vaccinations are quite safe. Okay, yes, I'm not saying that they don't have side effects. They do have side effects, and out of these vaccinations, many of the vaccinations are live vaccines. And in live vaccines, we cannot give to anyone who have some immunological problems, like in which the immunity is down, because they are harmful for them. Quickly, I few things which I remember. I will tell you. For example, um, all the live vaccinations. Okay, whatever it is, you can see in the books like what are the live vaccinations. There are mnemonics also given for them in the books. We don't give them to anyone who have any problem with the immunity. Okay, so most of the vaccination nowadays, they are safe. They don't cause anything. Yes, of course there are some side effects. For example, there are some local side effects of the vaccinations. Okay, which are the side effect of any injection which you're getting. For example, what can be the local side effect? I can write over here. It can cause at the site of injection, it can cause redness, or you can say induration. It can cause pain or tenderness. Okay, it can cause swelling simply at the site of injection. That's it. There are some systemic side effects as well of nowadays these vaccinations. For example, after many vaccinations, they can get fever. And what we do, by the way, simply we ask the parents that, okay, maybe the child will be having fever for one day. So if the fever is like getting high, so just give one dose of paracetamol. That's it. Okay. Some people, some babies, they develop rash also. They become very irritable after vaccinations. Okay. So this thing, like, these are very common side effects, guys. Okay, some of the babies, very few allergic reactions can be there after vaccination, like urticaria. Okay, and like anaphylaxis is a serious one, of course. Anaphylaxis. Okay, so anaphylaxis is a serious reaction, of course. So I have experience of China, I have experience of many other countries, but in my country, or in many countries, by the way, most of my life, whenever the baby have mild fever, they do vaccinate them. Okay, but in China, for example, if the child have even a mild fever, they don't vaccinate, and they ask you to come when the fever is gone. Okay, so remember, but fever, a mild to moderate fever is not mild to moderate one. Moderate fever, it's not a contraindication for vaccination. Like, you can give vaccination. Okay, but what are the contraindications? Okay, even they say, like, if the baby have mild upper respiratory tract infection, the mild one, again, give them vaccine. Okay, that's completely fine to give them vaccine. But yes, of course, if any baby have any allergy history, a documented allergy history or a previous anaphylaxis, okay, so of course, uh, don't give them that vaccination. Don't give them that vaccination anymore. Okay, of course, in that case, what do you have to do? You have to discuss it with the specialist. Okay, so all the vaccination do have side effects, of course, like some specific side effects I am saying. Okay, but of course I'm not going to going in detail of that right now, and I will not go in detail of that like anyways. Okay, so that's all for today, guys. I hope you enjoy this lecture, and next lecture I will start with like talking about the growth and development, and I will show you the growth chart as well, how the babies after birth, they started growing. Till then, see you guys.